Hi, everyone. Welcome to New to the Street. I'm Anna Berry, and today I'm joined with Dr. Joe Palumbo at BioVie Inc. It's a clinical stage biopharmaceutical company dedicated to developing innovative therapies for neurological and neurodegenerative disorders, including Alzheimer's and Parkinson's. Nice to see you today, Doctor. How are you?
I'm very well. Thank you so much, Anna. Really delighted to be here and talk about some of the work we're doing. It's an exciting time.
Such important work. As we know, so many of us know Parkinson's is a debilitating disease and it affects millions
Right.
worldwide. So talk a little bit about BioVie's latest research and how it aims to address these challenges that patients face.
So we're developing a new molecule. And the molecule is called bezisterim. And bezisterim it's different. It's different from the other molecules that have typically been developed for the treatment of Parkinson's. What makes it different is that we're treating inflammation. And inflammation is a condition in which the body tries to defend itself, gets a cellular response, a biological response, but perhaps in Parkinson's it goes too far. And bezisterim is a molecule that tries to reset the balance. And we believe that by resetting that balance, we allow energy to go where it needs to go for cells to and neurons to function as they were intended to, and hopefully to restore the ability to move, restore the ability to think in certain cases, and help people even sleep better. So these are the things we're beginning to look at because Parkinson's is complex and this molecule is different.
Wonderful. Well, that's great news on that front. And we're also going to talk about long COVID. There's still
Correct.
so much we don't know about long COVID. So talk a little bit about what are some of the key findings your team is uncovering and how might they shape future treatments?
Yeah, so it turns out that long COVID is also, at least in part, an inflammatory disorder. And we can look at chemicals in the body, things called cytokines, other molecules that change how the body reacts to invaders, how the body reacts to small changes in its environment. And we can see that this level of inflammation appears to affect how patients with long COVID are able to think, how energetic they feel. And so what we're looking at is, again, this molecule, this same molecule, bezisterim, in a grant provided by the Department of Defense. And we'll talk about that, I think, later. But by correcting, again, this imbalance in inflammation, by allowing the body to use energy in the way it is intended, we're hoping to improve some of these symptoms of brain fog, of inability to get work done. So we're looking at all of these things in these two separate studies.
Well, with that said, talk a little bit about that grant you mentioned by the DoD. What is that about?
So we've received $13.1 million from the Department of Defense, and it's important for us to talk a little bit about that because we're asked to reference the source. Now, this was a competitive grant. A number of different organizations, universities applied, and based on our mechanism of action being different, being able to address these symptoms and signs of inflammation, we were approved with the grant, and we're just about ready to start. We've selected our sites. The molecule, the drug that we hope to become a drug, has been shipped to the sites, and we're just waiting for a go signal.
Wonderful. Well, we hope that is very soon because this is such important work that can reach and help so many lives. So thank you so much for joining us on New to the Street. I look forward to continuing on this conversation. And for our viewers, it's BioVie, B-I-V-I. Thank you, Doctor.
Thank you so kindly. Bye.
Bye-bye.